Good morning, friends. Am I audible?
Yes, yes, you are.
Okay. Good morning, and my sincere thanks to CII for number one, organizing this very important conference on an absolutely critical, I would say important, critical topic, and also for the very kind invitation. As always, the topic assigned to me is to just discuss the various health issues um, related to air pollution. And in the next 10 minutes or so, I'll quickly take you through the various health impacts, including a very landmark study that we ourselves, Lung Care Foundation, did recently. And the report, which was just released a few days back and has also been published in the Lung India journal. So the I would start with this slide about an experiment we did. Are you able to see my slides?
Yes,
Yes,
Dr.
let's
Kumar,
hear.
very much.
Thank you. So this is an experiment we did in 2018 when I was at Gangaram Hospital, where we wanted to show to people what I, as chest surgeon, see every day in my operation theater. So I do about 4 or 5 lung surgeries every day, and every time I open the chest, I find black deposits on the lungs of people, even non-smokers and even teenagers, which is what actually moved me about 6 years back to start this Lung Care Foundation, to share this information with people. But to show the same, I can't take everyone to theater. Images, of course, I have been showing. So, but to show the same thing pictorially to people, we did this experiment in which we had this replica of lung made of HEPA filter in the shape of a lung. And to mimic the process of breathing, we fixed a exhaust fan behind it and adjusted the speed in such a way that in 24 hours, the same amount of air passes through the lung, through this artificial lung, which passes through our air, which is about 25,000 liters. So what we saw was that on day one, when we inaugurated it, it was pristine white in color and much earlier than what we expected. We expected it to become black in about 2-3 weeks time. But as you can see, by day 6, both the lungs had become black. So much of pollutants were passing through it. And this is what I see in my theaters. To your extreme left is a normal pristine lung, which I hardly see these days. In the middle is the lung not of a smoker, but a non-smoker from Delhi. And you can see how many black deposits. If you compare the left one and the middle one, you will realize how much of deposits. And most tragic is the image on the right side, which is a 14-year-old boy who also has got these deposits. And I always show this slide that this exposure to air pollution does not wait for us to become 18, 20 years old, as used to occur in the times of smoking as the main cause of causing damage to lung, because typically around 17, 18 people used to start. Right now, a child who will be born, all the children who will be born in our city in the next 24 hours, from the very first breath of their life will be breathing the same air that we are breathing. And if it has the PM 2.5 of more than 200, which is equal to about 10 cigarettes, they would be smoking this much cigarette from first breath of their life. So I dare say that we have newborns becoming smokers in our country. And how does it impact the health of our children? And then when they become adult, what happens to them? I'll show you through some of the exercises that we did. So we did this study to compare the health impact of this air pollution on the lung health. And we did this study in about 3,200 school students across 3 cities. So Delhi was taken as a sample of a highly polluted city. And we compared the lung health of children in Delhi with 2 cities in South, Mysore and Kottayam, where the pollution is much less. And this report, this has been published in the last issue of Lung India, which is an index journal published by Indian Chest Society and is the #1 journal in our country in the field of chest. We first give them a questionnaire in which we ask them about their symptoms like sneezing, itchy watery eyes, cough, rash, shortness of breath, chest tightness, and eczema. And you'll be surprised that over 50% children in Delhi, and these were 1,200 children from two major schools in Delhi, over 50% of them complained of sneezing, 45% had itchy watering eyes, 40% had cough, and nearly 30% complained of shortness of breath. And all these figures were much higher here as compared to Kottayam. Most shocking was that after the questionnaire, we did an on-site spirometry using state-of-the-art spirometer, and we had a trained team of technicians and doctors go to each of the schools and do it under our direct supervision, which is something which has been done first time in our country. It was a logistical nightmare, but we organized it with the help of Shakti Foundation. And we were horrified to find that nearly overall about 30% of the children had spirometry proved asthma. The figure was 37% in boys and 19% in girls. When we look, so this is the figure 29%, which was much higher than Kottayam and Mysuru. And it is known that Kottayam and Mysuru have a higher incidence of asthma because of genetic and other reasons. But despite that, I think the air pollution led to much higher levels here. What was shocking from this study was that we found 40% of the children were either obese or overweight. Again, a figure much higher, which means that there is some link between air pollution and obesity, something reported first time from our country. And when we looked at the correlation between obesity and asthma, we were horrified to find that there was 50% to 200% increased odds of an obese or overweight child having asthma. So there was a connection between air pollution and obesity, and there was a connection between obesity and asthma. And again, all these odds were much higher in Delhi as compared to other two cities. So we proposed in this paper that air pollution directly is causing asthma and is also acting through obesity, which is leading to asthma. So this is a double whammy which the air pollution is unleashing on these children. So with all this happening, and these were children in the age group of 14 to 16 years, what does it lead to? I would like to share this slide of my 30 years of clinical experience as a lung cancer surgeon. I started my career as a consultant at All India Institute in 1988 when I started operating on lung cancer. And 2018, when I was at Gangaram, I again analyzed my data and see the difference. At that time on your left, 90% lung cancer patients were smokers. And this time that figure has turned to 50-50, which means 50% of the patients now are so-called non-smokers. Average age from 50 to 60 has come down to 30 to 40. Very few women at that time, more than 50%, more than 40% patients now are women who are non-smokers. And why is it happening? The reason lies here that if you have children getting exposed to polluted air and toxins from the first breath of their life, by the time they become 30 or 35 or 40 years old, they actually have been a smoker for those many years. And that's the reason why I'm seeing lung cancer in 30s. Oftentimes people ask, doctor, which are the organs affected? I showed this picture. From brain to toe, there is no organ which is not affected. And this is actually causing not only disease, morbidity, but also death of a lot of people, as we are all aware that it's shortening our lives by at least 8 to 11 years in different cities, depending on the level of pollution, and is leading to millions of premature deaths. So there is a huge, so I would like to state that air pollution is not a chemical issue. It's not an environmental issue. Friends, it is a pure health issue. It's a question of health of our present and, more importantly, future generation. What we need to do, this is about the scary part. So what do we learn from this scary part? As a doctor who's traveled across the country, I find that despite all the media and other attention, there is a severe lack of awareness amongst people. People are just not aware about what is pollution, how much it damages health, and the final effect that it is having on their health. The awareness level is abysmally low. So as a doctor, I feel the biggest challenge is to make people aware, because when they'll be aware, they'll be awakened, and when they'll be awakened, they will be willing to take action. So what we need to tell people is that air pollution and climate change are not theoretical issues. They are existential threat to us. It is not an environmental issue. It is a health issue. And fossil fuel overconsumption is the main driver of both. The planetary health is deteriorating, and that is leading to deterioration of human health. They are linked, and unless we take care of the primary cause, the solution will not come. I feel that doctors have a huge role to play, because I say that they are motivated. Why are they motivated? Why am I missing my operation room and sitting here and addressing? Because I feel motivated and involved because of the effects that I see in the theater every day. So doctors are motivated because they are seeing the health effects. And why are they good motivators? Because when I, as a doctor, when I talk to people, it's a health issue and this is how your health is getting affected, they listen to me because it's my area. So I feel that doctors are motivated motivators. And that's why 2 years back, Lung Care Foundation formed this group called Doctors for Clean Air, which is just a body of passionate, informed doctors from any field, from anywhere in the country. It's a loose group. Only thing is you should have commitment to this topic. That is the only requirement. And I'm very happy to report that when we launched it in December 18, we have 12 leading national medical associations representing surgeons, physicians, pediatricians, gynecologists, neurologists, cardiologists, cancer experts, representing over 150,000 specialists who actually endorsed, and these are their presidents, who assembled and signed this pledge that we all will work in the area of raising awareness, making people awakened and making them commitment. And I'm happy to inform that due to our repeatedly showing these pictures all over, this picture was shown in a parliament also last year. And when we released the asthma study recently, within a week, this study was quoted in one of the NGT orders regarding the air pollution issue. So I feel that this Doctors for Clean Air should spread. Doctors should be engaging more and more in this area, because I don't think there is any more time to waste. This action should actually have started yesterday. We missed it, but the time to start it now, because I strongly believe that if you don't do what is needed to be done even today, then we better prepare to perish, because that is what it will lead to. The kind of damage it is causing to the flora, to the fauna, to our future generation. There is no way that we can let these things remain as they are and still dream of having a healthy future. So therefore, it's time we start acting in order to improve the health of the planet, which will lead to better health for the inhabitants. Thank you very much, ladies and gentlemen, for your precious time.